There's no silly question. There's no stupid question. Every question is relevant when you're thinking about your child's health, your child's well-being, your health, your well-being, the functioning of the family. It's all connected. So you're doing an amazing job. Lean into those supports, lean into those resources, ask for help.
Hello, Kaya and Wanju. Welcome to Kiind Conversations, your go-to resource for guidance, support and empowerment. I'm Teresa, Peer Navigation Lead here at Kiind and your host. We'd like to take a moment to acknowledge Aboriginal and Torres Strait Islander peoples as we are recording this podcast on the Budja of the Whadjuk Noongar people. We'd like to pay our respects to all Aboriginal and Torres Strait Islander cultures and to elders past and present. I'm joined by my fellow peer navigators today. We're excited to have Pauline back. Hi, Pauline.
Hello. It's great to be back.
Awesome. And let's welcome Helen to the first episode, or her first episode of Kiind Conversations.
Thank you for having me.
And so, Helen, would you like to share a little bit about yourself with our listeners today?
Absolutely. My name is Helen. I'm an Aquarius. I like long walks along the beach. My name is Helen. I'm a mum of 4, neurodivergent family, and my older son has type 1 diabetes. So, yeah, a little bit challenging at times.
Busy household, it sounds like.
Very busy household.
So how did you find the first episode?
Oh, it was wonderful. It was great that we've got a resource that can support families navigating, what can be a really challenging time in a family's life.
Yeah, and it was great to see we had lots of lovely feedback already about the podcast.
Yes, definitely. I mean, I won't lie, I was a little bit nervous to start with, but then, I thought as it went on, we sort of, really got into the flow of things. And like you said, there was some really positive feedback, which was really, really nice. So, yeah, I'm just really excited to be back for another episode.
Awesome. While we're still on school and preparing for the school year, which is what we spoke about in the first podcast, how was everyone's first week back at school?
Not so great. Things didn't go, really smoothly for us. My little one, she was not happy about going back to school. But I guess after, almost 8 weeks of, lounging around and being fed snacks and watching her iPad, I don't blame her. But she normally takes a few weeks to settle in. So the second week was definitely a lot better than the first. So
awesome.
Yeah.
And Helen, how was back to school at your household?
I think a lot like Pauline, incredibly grateful that children have gone back to school. We also had 8 weeks off. So it was a little bit of a struggle to get into the new routines and to bring everyone's back sleeping patterns back into an agreeable format. But I think we're getting there.
Oh, lovely. In each episode, we explore the topics that matter most to parents and carers raising children with disability. Simplifying the caring journey, one conversation at a time. Now for this episode, we're moving away from education and to the health setting. We understand that for families caring for medically complex children or those that are frequently receiving inpatient or outpatient care, navigating the medical system can be an extremely overwhelming experience. This is especially true when your child is very young or you're new to the diagnosis. So we're going to help you build your understanding of the healthcare system. For some of our listeners, the term medical literacy may be new to you. It refers to your ability to understand and access the health system so you can secure the best outcomes for your child's care. There are many reasons why this is important. Knowledge is power, so the better you understand your child's condition, the better you can support them. It can help you explain your child's condition to your family members, members of your child's support team, and to the child themselves. We recognise that not everyone's experience within the health setting is going to be the same. We know that many families have different cultural needs or face other barriers to accessing the support they need. We'll do our best to address these and provide some practical guidance along the way. But remember, you can always reach out to us at Kiind if you have any questions or need any additional support. Now, Pauline, Helen, you both have experience on this topic, whether it's from caring for your own children or supporting families as peer navigators. What would you say are the most common questions parents and carers have around medical literacy? Pauline, you want to go first?
Yeah, I think families would like to know how to prepare for their appointments and also how to make the most out of their appointments, and that includes, the best way to communicate with their child's team.
Awesome. And Helen?
Yeah, I think tying on to what Pauline just said, a lot of it is, how to advocate when you have concerns about your child's health and your child's care. We hear that a lot.
Yeah. So thank you both, and I'm sure a lot of our listeners can relate. So let's start sharing some tips that can hopefully ease some of these concerns.
Hi everyone, it's Pauline, Peer Navigator at Kiind. I hope you're enjoying the episode. Before we get into the nitty-gritty, I just wanted to let you know a little bit about our hospital support program, made possible thanks to Telethon. Did you know that the Kiind team are at Perth Children's Hospital? Whether you're at hospital for a routine appointment or staying with your child who's receiving treatment, Kiind is here to support you. You can find us on the ground floor in the Family Resource Centre, or we can visit you in the wards to check and see how things are going. We are here to provide a listening ear along with information and resources to help you navigate the world of disability. For more information on how we can support you and your family in the hospital, call us on 08 6164 9806 or email support@kiind.com.au. Now back to the episode.
So Pauline, what are some of the things that families can do to prepare for their appointments with their child's treating team?
I think definitely sort of start with those basic things that you're going to need to know, especially to prepare for the appointment, to do with parking, visitor guides. You can visit, say if you're going to a hospital, you could visit their website, check out what they have as far as any videos to show, maybe the children where they're going to, what things look like. It might help to reduce some anxiety, to do with parking. Is it paid parking? Is it cash? Is it card only? Yeah. Especially for accessibility reasons as well. Do they have ACROD parking? Is it going to be far away? Things like that. And then also community support services that might be on site, like Kiind at Perth Children's Hospital.
Good segue there.
Yeah. Also any translation services or Aboriginal liaison officers. I think going back to talking about, information on websites and visitor guides. Some organisations also have social stories for to share with your children, and that can be a really great resource. If they have anxiety or just really want to know where they're going and what's going to happen.
So Helen, around preparing for the appointment, what else have you learnt yourself as a parent or carer? Or what have other parents shared with you in your conversations as a peer navigator around preparing for appointments?
In regards to preparing for appointments, making sure that you've got all the information you need for your appointment can be really overwhelming. Sometimes you may get a week's notice that you've got an appointment coming up. Sometimes you might have 3 months' notice. So having a notebook or somewhere where you can jot down all your questions and also all your documentation of what you've observed your child doing, temperatures, behaviour, physiological aspects, physical aspects, anything that's related to your child's condition that you're seeing your treating team about, writing all these things down so your specialist or your treating team have an understanding of why you're coming in and what you've observed as your child's expert, any new symptoms, any new behaviours, the child's routine, because that also gives them further evidence and information to structure, treatment moving forward. Another really good thing to bring is your child's purple book from 0 to, is it 3 years or 4 years? I should know this information. But it's really handy because your child health nurse would have documented when all your immunisations were, what the birth was like. It's all that historical information that can be really, really handy when you're seeing your treating team or your specialist. So having that as well. And also bringing your appointment or referral letter, especially when you're coming to the Perth Children's Hospital. It's got the little barcode that you scan. So that's always helpful, especially if you need to go to the reception desk or whatnot. Your child's referral letter will have your child's details on it. So that's something that you can present as well. So that's always handy to have as part of all the things you need for your appointment.
And I think also any forms that maybe the doctors need to sign, make sure you take those along as well. And so going back to your first point about documenting behaviours, I think also maybe gathering some information from, if your child's at school or if they're seeing a therapist, because your child can act differently in different situations. So they may also have seen a change in behaviour. And so, it's good to sort of get some other points of view as well on how your child's been.
Absolutely. And adding to that, I guess video documentation as well. Having a little, 30-second bite of your child's behaviour or whatnot. It's sometimes easier to show a specialist or treating team what it is as opposed to trying to describe it. Especially if you're overwhelmed by the situation or there's a lot going on and you've got a really short period of time to, sometimes you only have half an hour to meet with them. So being able to give everything as concisely as possible is really helpful.
Idea.
Videos and photos are very powerful when you're wanting to share that kind of information because, your little person might decide not to show that behaviour.
Yes, exactly.
during your appointment. Or it might be a reaction to a medication.
Yep.
That is difficult to show at a specific time. So, very powerful things to share.
Very, very handy.
And Pauline, is there anything else that you can think of, any tips that can help families prepare for their appointment?
So, from a personal experience, one of my children was having surgery and he was feeling quite anxious about it. He wasn't sure what to expect and what was going to happen. So I did a bit of searching, and PCH actually have an app that they endorse, and it's called the Magic Coat, and it's a great app, and it's how to prepare children who are coming along to Perth Children's Hospital for surgery, and it's got some wonderful interactive games, characters, and it really helps the children to realise that it's okay to be having some emotions around, going into hospital and having a surgery. And it's sort of, it's trying to build some resilience, I think, and just talk about their feelings and things like that. And it's a free app, and it actually also have a lot of pictures of the characters around PCH, so the children can look at them and say, oh, I know, from the app I know that character. And they make the videos of sort of where the children are going to be walking through, like they can see the waiting room and the pre-op area and those kind of things are actually made in PCH. So the children are actually seeing where they're going to be. Yeah, so for my son, I know it definitely answered a few questions that he had, and sort of it also gave a distraction on the day because we had that there and you can play games and things like that. So I found that really handy. So I think we'll have the link and information on that in our show notes. So it's a good one.
Awesome. And I think it's just about making the child feel comfortable and relaxed and prepared as best they can. And I think if your little person has comfort items, take them along with you. Mm-hmm. If they have specific food treats that they love that you might not be able to purchase at the last minute, take them along as well. Make them feel welcome in that process and really comfortable to move ahead.
Yeah,
absolutely.
I know.
The resistance is real.
Yes. But, even, if they've got a favourite toy, a blanket, something familiar that they can have with them, charge the iPad. If your child's allowed to have their iPad, make sure that's, charged. Also bring a charger with you because, that can run out pretty quickly, especially if you have to wait around for a while. So, yeah.
And I think, what you mentioned before about Magic Coat, preparing your children for these appointments, you're preparing yourself mentally for what's going to happen and occur, but preparing your children as well. My child is, my child catastrophizes very quickly, and he's very resistant to new things or things he doesn't want to do. So if you've got a child who has some medical trauma, who has had some really bad experiences in a hospital, it takes a lot for a parent to to prepare their child for that experience. So, bringing in whatever you need, like you said, make sure the iPad's charged, get them familiar with the situation, bribery, if that's what works to get them through the door and get them through the treatment or the procedure. Absolutely. Like, there's no judgment from any one of us, and there's no judgment from there should be
any nurse, any treating team.
Yeah.
And I think from the families that we've spoken to, I don't think anybody has ever said that a nurse hasn't tried to go above and beyond.
Yes.
Or the sort of ancillary services haven't tried to go above and beyond to support the little person and getting them the appointment that they want as best as they can, with obviously not creating more trauma. And I think going back to the bribery, whatever bribery you need, you do it. But also, I know a few families that come and visit PCH, and this would be in any sort of medical setting. The bribery was just around creating a little space, a little nice day out. So it was making sure they left time to have a little play on the playground, that they checked in and then went up to Fun on 4. Now, again, that's specific to PCH, but you could do those things as well if you're out in community setting and you're going to a community appointment. Do something that the little person likes to do, and then say, we're going to stop in here and have a quick chat to this doctor or this person, and then we're going to go home, or then we're going to do something. And that can be really helpful.
Positive psychology.
Yes, bringing something positive in there.
Yeah. Some of the things I would recommend is probably compiling a list of questions that you want to ask your treating team. You can gather those questions from yourself, family members, friends of families that interact with your family. You can also gather those questions from your child's teacher, any of your supporting therapists, and compiling those can sometimes give you a good overview of what you would like to talk about in those sessions.
One thing I share with families as well is building that information around the appointments for a couple of reasons. It takes away some of that overwhelm and feeling like you as a primary carer need to keep all of that information swirling around in your brain. You get to put it down. So prepare those questions and pop the answers in that you get during the appointments. But also it means if you have an appointment, you've been waiting for a long time for it, and on that particular day you need to be elsewhere, if you have like an exercise book or a file, you can hand that on to somebody else. They can still do the appointment for you, so you don't feel like you need to be there all the time. But the questions get answered, you get the information of what happened in the appointment, and that can just help with some of that overwhelm of being primary carer.
Absolutely. And I agree with you that getting it into a concrete format, because there's so much information that we have to contain in our heads as parents and carers that, and sometimes we think we've really got a good handle on what we want to ask when we get to the appointment, but as soon as we walk through the doors, it's like this automatic amnesia where it's you can't even remember what you had for breakfast. You don't know what you want to talk to so you're hoping at some point that something will spark. And it's not until you get to the end of the appointment that you kind of go, oh, I forgot that one, or, I forgot to ask this. And then it's that stress again that you're going to have to wait to the next appointment to discuss that.
Yeah.
And so I guess definitely having it written down or having some sort of visual cues to remind you of what you want to discuss is really helpful.
Yeah, exactly. And especially if it's a new diagnosis and you're at the very start of, a journey, it can be very emotional and stressful and your emotions are just all over the place. You're trying to listen to what's happening, but also, all those emotions are coming up for you. So, yeah, it's good to have those things if you can be taking notes or having someone take notes and that way you can look back on it and then also maybe even look at it afterwards when you've had the chance to sort of take everything in and after the appointment and because it can be a very scary, stressful time for families.
So that brings a really good point when you're talking about being emotional in those sessions. Having an advocate or a support person within, to assist you in that appointment can be really helpful because sometimes it means that they can take over if you're feeling flustered or overwhelmed, and just to make sure that the conversation stays on topic and that hopefully it's driving towards the outcomes that you want to see within that appointment as well.
Yeah, I agree with that.
And I think what can be good, when we're talking about bringing people along, if English isn't your first language, it might not even be your second or third language, feeling a little bit overwhelmed by medical jargon can make you feel really worried about upcoming appointments.
Mm-hmm.
So always know that there are interpreters available. So the health system has access. If you're coming to PCH, you can make sure that an interpreter is involved. Even if you feel really confident with your English, there's no harm in just having someone come along that can be a supporter, and they'll be a supporter in your first language, just to help things along, take away some of that overwhelm.
Yeah, that's so true.
Yeah. And also there's things in the English language that has a different interpretation in another person's language. And when we're thinking about health, making sure that everyone has the same understanding of what's going on and what's being said is really, really important, not just for the treatment there, but further on down the track.
Yes.
Yeah, and I think that active listening can be a really good tool for families as well. So, you're emotional, it might be a new diagnosis, you're not quite following. Certainly I find having completed human biology at high school helps me a little bit when we're having these conversations. But if you didn't do that pathway, you might not have that sort of grounding. I also worked in pharmacy for a little while, so I feel like I've got a little bit of a handle on some medical terms. But you might not be coming into those appointments with those things. So clarifying what's been said, get them to slow down what they're sharing. If you're finding it a bit too overwhelming, ask if they can put things down in writing, like we said, and really making the appointment go at your pace.
Absolutely.
Like, speak about how you're feeling a bit overwhelmed. You want someone to support you with really understanding. So going back and getting them to clarify your understanding could be really helpful.
Yeah, exactly. And it's bringing it. I kind of think about, when I was first learning about diabetes, and it's kind of going and getting them to just bring it down to a point where I can understand it. Because I didn't do human bio, so I have a very, very basic understanding of how the human body works. But getting them to kind of put it into layman's terms that I can understand and I can process and I can compute, and then I can move forward with that same understanding as they have.
Coming back to that knowledge is power. You don't need to know everything and the ins and outs of your child's diagnosis, but being able to show that you know what you're talking about, you're the child's expert knowledge holder, you will listen to me because I'm understanding. So that comes from having those building blocks of understanding the diagnosis. So moving forward, you get to really be a strong advocate for them.
And also letting them know that you are learning the information. You haven't got 10 years of medical experience behind you, so you're a complete novice. But, tell me these things, because I'm trying to learn, because at some point I'm going to have not as much knowledge as you, but I'm going to have a fairly good understanding as a parent of what my child's condition is, what their treatment's going to be, what future treatments are going to look like. So, let's get on board as a team now and work together, because, this is all for the benefit of, the child.
Mm-hmm. And I guess to follow on from that, I also think that, keeping records from, if you can, the very beginning is really important. And it's a great way to be able to help you communicate with your child's team. And then, you can get the best possible outcomes for them. So, it could be a folder, reports, it could be just include everything that you've steps along the way. I know some families sort of keep a folder with important documents, birth certificate, all those types of things, but then also have a folder with reports from therapists, appointment letters, anything like explaining their diagnosis or anything like that, so that then it's easy, it's in one place. If you have an appointment, you can just pick it up and take it with you and go.
Yeah, and that's such a great idea, because that means the history of the child is in there. Especially if you're moving to new therapists or service providers that may only have a glimpse of what, some knowledge of what's going on now, but not the history. It's really good for them to have a really good oversight of where the child has come from and where the child is now. And hopefully that means that, there's a more holistic approach to the treatment, and that they're getting all the information, not just looking through your child, like looking at your child through a keyhole.
Yes. And another thing is, there's a lot of information online now that we receive. So I know some families also set up an email address that's separate, so that then it's actually, all the health related things for their child actually go to that email address, so it's all in one place, because some places don't send out, a paper copy. So yeah, that could be also, families might find that easier than trying to troll through all of their emails that they get each day. And yeah, that's just sort of a go-to if you need to access any of the information.
Yeah, and I know of some families that have even, you can set up a Google account if you're happy with Google or Outlook, and you can have an email account just for the NDIS information or just for health information. So you can set up multiple email addresses and shoot all the different documents to each of those different email addresses.
Yes, that's a good idea as well. I think kind of breaks it down and puts it into those separate categories.
Compartmentalises everything.
Yeah.
Because no one wants to sift through 21,000 emails
to
find one document.
Yeah.
And, when you're chatting about these kinds of record keeping and building your knowledge, my heart and my mind always goes back to those families that are navigating genetic, rare diagnosis, where there might be only, a few people around the world, a couple of people in Australia. It's not fair, but you actually might be the teacher for everyone that you come in contact with. So having all of that information written down, building your own knowledge, because it might be the case that you are the expert knowledge holder in WA for that diagnosis.
Or even the country.
Yeah.
You might be carving a path for families that are coming behind you.
Yeah. Okay, so now we're coming to the appointment with all the right tools and the preparation that's going to work best for us and our family. What can carers do to make the most of these appointments and improve medical literacy? To start, Pauline, going to you first, what are some of the questions that you could be asking your child's treating team?
I think, we'll start by saying that no question is a silly question. So I think, if you're in the appointment and there's something that you don't understand, definitely ask for clarification. There might be, acronyms that the medical team are using that you may not be familiar with. So definitely ask for, what the meaning is and what the actual name is. And it's also great to write those down so that, if you in the future have to advocate for your child, you know exactly sort of, what you're talking about, and other people that you're talking to can understand, what you mean and what the diagnosis is. And I think also asking if they're seeing a few different teams, you can ask, can those teams sort of communicate with each other to try and get the best care for your child, because that can be quite difficult if teams aren't working together, and if you're finding that difficult, it can be nice if they can actually sort of communicate and work together, and that can get a better outcome for your child. I think it is really important to understand the treatment and medications that your child will be undergoing and taking. So, understanding what the risks are of any treatments, also any side effects from medication, as if they're taking several medications, there can be contraindications, which means that, those medications can sometimes maybe not work together, and so it's really important because that can be very risky. So definitely asking those questions, I think, is very important.
And Helen, do you have any other tips to share around questions for your child's treating team?
Absolutely. So one would be to ask for as much information as possible and where they're getting their research from. Ask those questions, because then that helps you know what you're looking at, know what to look for, because ultimately you will go on Google and you will look at these things and you will fall down lots of Google rabbit holes.
Google doctor.
And to add to the further overwhelm, you want to make sure that you're making the right decisions for your child on behalf of your child, and you want to have a fair and full understanding of all the risks and benefits involved in anything that's related to your child. So asking them, what's the research? Where can we find that research? Can you point us in the direction that can further support us as parents to be fully informed about what we're learning and what we're doing, so we can, assist you in what you're doing as a treating team, but also make sure, that we're working collaboratively, so we're all, singing from the same song sheet.
Because you want to make sure that any medication or any surgery that is going to occur is not actually going to be more harmful.
Absolutely.
Than helpful.
Yeah. And the onus is on the treating team and the medical professionals to give you all the information. It's dignity of risk. They need to make sure that you have all the information that you need to make the right decisions to support your child. And the onus is on them to provide you with that information, because ultimately they're the ones with the knowledge, and they're the ones that need to share that with you. Because, again, most of us aren't doctors. Most of us aren't nurses. Most of us don't have those years of experience working in the medical field. So we need to be well informed so we can make the right decisions for our child.
And adding on to that, I also think that, if you have several doctors, attending, you might want to clarify, okay, who do I actually ask the questions to if I have something, who's actually, the person that's best to go to out of you, rather than trying to speak to which one. And,
I think that can help for them to see that it is a holistic view and a holistic support service that you want for your child. So making sure that they're aware of who you feel is the lead, like treating team part of that team, could be really helpful as well.
Absolutely.
Yes.
Things are going to be clear. This is not the time for fuzzy, vague, I think we're doing this or I think we're doing that. It really is a time for, all right, let's have let's have the facts. Let's have all the clear knowledge. What's concrete? This is what you've said. All right, okay, then we're going to trust that as truth and let's move forward, as opposed to, I think this is what they said. Let's have everything down as concrete, clear.
And who's in the room, who's part of the conversation, who does this information need to be shared with every single time?
Yeah, exactly. Hi, it's Helen, Peer Navigator at Kiind. I hope you're all learning a lot of valuable insights in this episode. I just want to jump in here to let you know that we're always here to support you whenever you need it. If you want to talk to us rather than listen to us, we can provide individual support when you need it. Kiind's free pathway planning sessions are dedicated to supporting you through various milestones and key points of transition throughout your child's journey. Pathway planning sessions are informal consultations where one of us peer navigators will help you identify your current needs, provide practical guidance, answer your questions, and help with pathway planning. Pathway planning sessions are available by phone or video call, giving you the flexibility to access support in the best way for you. If there are any other issues that you would like to discuss, such as NDIS, financial supports, transition to adulthood, and support for carers, we're here to help. To book a pathway planning session, you can visit our website at www.kiind.com.au. Now let's get back to it.
Thanks, ladies, for those practical tips. I think it's awesome for families and carers out there listening just to have a little bit of knowledge. We've said already, knowledge is power, and having those useful tips will be really helpful for a lot of families. And I think where we go to now is, we mentioned earlier that there are common questions raised by carers that we've spoken to on how to advocate when you're having a concern about your child's care, maybe around the process or the outcomes that you thought you were going to have but maybe weren't there for you. So having a strong medical literacy can help with this, as it gives you a better understanding of your child's care needs and the processes that the healthcare setting have in place. Helen, what advice can you give carers around this?
Well, to add to the further overwhelm of navigating the medical system with a child that may have medical, concerns or some complex conditions, a lot of it, it's hard to say, because as a parent, you're feeling really vulnerable and there's so much to undertake. And I guess what I'm going to say next is going to ask a lot of them, which is you need to educate yourself on what's happening. It would be great if we could just have someone else deal with everything. But ultimately, it's on us to take it all on board. So educate yourself, find out more about your child's conditions. If you need to find information that is easier to easier to process or in words that you understand, like come talk to us. We'll try and point you in the right direction about supports that are in place to help you. Becoming a stronger advocate, so being able to sit there and go, I don't understand, please, can you please supply me with more information? Connecting with those other support groups as well. If you have a child who's got a rare condition, or even if you have a child that may have autism or ADHD or another condition that may not be as rare, but you still would like more information, you still want to make those connections and supports, reach out, find out who's available, who can talk to, who can connect with, who can provide some mentorship around it as well, because sometimes we do need someone to kind of hold our hand and support us, especially in those early years when we're trying to find our feet, when we're at the start of our journey and we really don't know what the road ahead of us looks like. But someone else may have been walking that path for a while. So connecting with those people to lean on, can be really, really helpful. So familiarising yourself with organisations that are there to support you. Health Consumers Council is a great organisation because it will help you learn more about your healthcare rights and what you can, expect from the services that you're interacting with. Another official protocol that you can utilise in Western Australia is Ash Warriors Call, which is an escalation protocol. So if you're concerned about your child's treatment or have concerns about your child's symptoms and you feel like that your concerns aren't being heard or you would like another review, you can connect with Ash Warriors Call. There's phones in the emergency department that you can access, and then they will escalate your call and get another team to come in and review your child's symptoms, behaviours, that current situation.
And it is awesome that that's available at all hospitals, not just Perth Children's Hospital.
All hospitals throughout the state.
The other avenue, if you are having concerns, is through the Child and Family Liaison Service. So this one is particular to Perth Children's Hospital. So if you are providing feedback, they have feedback forms that are available throughout the hospital. They also have officers that can help you if you've got some questions about care. And so that team are amazing and they're a lovely group of people and they're there to support you as well.
I think maybe for also some of our regional families or families that are linked into other hospitals throughout the state, there will be a patient and family liaison service or a child and family liaison service within every hospital. So if that's something that you feel that you need to access, you should be able to get that information through your treating team or on the website of the hospital that you're attending, just to let you know, because it's not, everyone has those mechanisms in place to support families and to support patients. So making sure that you're aware of them. So if you do have some concerns or even compliments, they like compliments too.
They love compliments. And there is amazing staff out there in all areas of the health sector in WA. We should let them know when they're doing a great job.
Exactly, because I'm sure they hear a lot more about when they're not doing a great job. But
yes,
if that is, something that, that information is readily available. If you're not too sure where to find that information, again, please come to us. We can kind of point you in that direction, wherever you are in the state. But just to let you know, the information should be available on the website of the hospital that you're attending or the service that you're attending.
Yeah.
Yeah.
And I think another great avenue of sharing your experience in the health sector is through Care Opinion. So again, this will be in the show notes, but this is an opportunity for you to just share your experience within the system. And it might not be that your particular challenge is addressed, but what it might do is just improve the entire system. So I think that's really important that we give feedback so that we can improve the whole sector for everyone that's participating in it.
Agreed.
Mm-hmm.
Great information, Helen. Thanks for sharing. So Pauline, do you have any tips on how to communicate your concerns and navigate those situations?
Yeah, I think as we touched on earlier, come prepared to your meeting. with all the information that you're going to need, including your child's records, and any other supporting documents that you might need. I think also trying your best to stay calm, and speak calmly, respectfully, as that can obviously help to, facilitate a more productive conversation. I know that can sometimes be really difficult for families, for people, because once again, it is all very emotional, very raw. If you do need to take a break, you could definitely ask, let them know. Look, I need 5 minutes. I need a glass of water. I need to go to the toilet. I just need to step out for 5 minutes. So, I don't think there's any harm in doing that, just to help, collect your thoughts and yourself. So, and then also going back to, taking notes, and they can be around the date, who's in the meeting, what was discussed, things like that. So, and you can keep those with your records so that if you ever have to look back on, a meeting that you've had or anything like that, you've got that information there on hand. Because, I don't know if everybody else is like me. I can't remember what I had for lunch yesterday, let alone, say 2 months ago we had say if I had a meeting with a doctor and what was said and what the date was and the time. So, I think that's really important to do as well.
Sorry, I was just going to interrupt you there as well. And it can be helpful, if writing isn't your thing, if you're if you don't feel like you're able to capture it, you might be able to record the appointment. Yeah, obviously, you need to ask everyone's permission who's in the room, but taking an audio, taking a video can be really helpful for you to really help document what happened in that appointment.
As mentioned in this episode, if you plan to take photos, voice or video recordings at your child's appointment at a hospital in Western Australia, please ensure that everyone present provides consent beforehand. Recording a private activity without the consent of all parties may be an offence. For more details, please refer to the episode show notes.
And then also, I think, engaging an advocate, someone that can, come along and make sure that your child's rights are being upheld. And so, if you speak to us at Kiind, we can definitely point you in the right direction of getting in touch with, and connecting with an advocate that may be able to help you. And then we also have on our website, we have some useful organisation directory. So you can always pop on there as well and have a look and see, if there's anything on there that you may be able to access.
Yeah, absolutely. So to our listeners, we hope you're feeling more confident and empowered by the information we've covered today. But before we wrap up, Pauline and Helen, what's one takeaway you'd like to leave with our listeners?
I think for me, I would go back to what you were just saying about recording or videoing the appointment or, an appointment that you're at, especially for people that may have difficulty, with processing or, writing, things like that. I think that can take the pressure off a little bit as well. But obviously you would need to get permission, from everybody that's in the room, the doctors and anybody else that's in there with you. But I think that could be a really great idea to then be able to listen back to and, do some research if you need to, or, just get some clarification. We might miss some points if we're feeling a bit emotional. So I think that can be helpful.
Absolutely. And I think, I'm just thinking when you were saying that, if you have a diagnosis yourself, so, I have an auditory processing delay, sometimes things I want to reply to an argument in, come hours later to me. And it's really annoying because usually I have really good comebacks. But, if you feel comfortable,
yes, of course,
share a diagnosis in those moments. If you do need extra support, if you need time, if you need processing time, all of those things, if you share those so that you can be supported as well.
Yeah, absolutely. And then the health system, it's trying to be as efficient as possible, which sometimes means that things happen in a really short space of time, but asking them for that space to be able to process is duty of care on their behalf. They should be there to go, look, we'll give you what you need so we can all make the best decisions possible to support your child and yourself through this journey.
Helen, what would you like to leave families with today?
You are doing an amazing job. There is so much information that you need to fit into your head that there's going to be times where you're going to get lost in it all. Lean on those resources. Find them and lean into them. Educate yourself. Don't expect to know everything straight off the bat, because you're not going to. There is so much information out there, and there's so much information about your child, and that information may or may not be relevant to your child. So trying to fit it all into your head straight off the bat is not going to help. Lean into your supports. If you haven't got those supports, find those supports. It's okay to ask for help. It's okay to go, I don't know. Can you please clarify? There's no silly question. There's no stupid question. Every question is relevant when you're thinking about your child's health, your child's well-being, your health, your well-being, the functioning of the family. It's all connected. So you're doing an amazing job. Lean into those supports, lean into those resources, ask for help. Help is always there. Talk to us. We're here to support you through your journey. We know what it's like, and while we might not have an exact understanding of what your particular journey is like, we understand that it can be tricky and it's challenging and it's overwhelming and it's all those things, but we're here to assist in your empowerment. So please lean on us as a resource. Ask us to connect you with those other resources. We will do our best to make sure that you can move through this with as much information and as informed as you can be.
And I think it's definitely a journey.
Absolutely.
And it's called a journey for a reason, because it's not going to be short and sweet. You it's going to be around for a long time. So the more educated you are, hopefully that will definitely help that journey.
And I think in this moment, just take the time to give yourself a warm hug, because you are doing amazing. Mm-hmm. You're doing an amazing job for your little people. And
your big people.
And your big people.
And all those other people that you're supporting in your life.
So, recognise that you're amazing, you're doing a great job, and it's okay to say, yep, I'm doing good.
Yeah. No man's an island.
Yes.
Yep. Especially in this field. No man is an island. We are a massive community. Let's support each other.
Absolutely.
Agree.
So that brings us to the end of the episode. Pauline and Helen, thank you so much for sharing your insights on medical literacy today. For links and resources mentioned in today's episode, please check out the show notes. Stay tuned for our next episode. If you don't want to miss it, make sure you follow on our socials. If you have a friend or know someone who could benefit from the information we discussed today, why not share this podcast with them? We'd love to have as many listeners as possible. The Kiind team is here for you. If you would like one-on-one support to help you navigate any issues with your family that